Stanford and Cleveland Clinic are the best in America. It would have been very easy for you to stay back and have a very comfortable life, great work-life balance, and make a lot of money.
Yeah.
Why didn't you?
You know, I always knew I wanted to come back. I always knew that I wanted to use my skills and my knowledge to contribute back home. Right? There were two dreams, right? I already built Arman, right? And I was running Arman from the US. Like I founded Arman during my first year in Stanford. For the next 6 years, I managed Arman from the US. And I knew I wanted to come back to India and take it through the country, right? That was an important dream, and nothing could, make me stay back in the US. Because I knew that I had to be back to be ensured that, it really achieved the goals that it was created for. Second thing was that, I had studied a field that didn't exist in the country. I was in urogynecology. There was no fellowship program in the country, and 1 in 4 women suffer from these conditions. And it was so important for me that I come back to India and build urogynecology in the country, help to build, and ensure that the poorest have access to my, medical skills. The thing that really bothered me was that, when you study more and more and more, you outprice yourself.
Yeah.
The people who need it the most don't have access to you.
Yeah.
So if I'd stayed back in, US and worked as a professor, I was always an academic person, so I would, become a professor, something like that in the United States. The people who needed me the most or needed access to my skill the most wouldn't have had that, right? And, where but in India, do you see the extreme ravages of the field that I am in, right? So it was so important to not only come back to India, but also come to government system.
So I want to start talking about I want to ask you about various things you brought up, but first let's talk about Arman. So apart from the fact that you have your private practice, you have the practice in government hospitals, you are running a not-for-profit called Arman, which is, I know, you've talked about a lot, which is your dream project, with the aim to give access to healthcare information to the poorest women. Is that correct?
So Arman is a maternal and child health NGO. It leverages technology to create cost-effective, scalable solutions to, on the one hand, inform women about the care to be taken during pregnancy and infancy, so they demand care, and on the other hand, train health workers at every level of the health system so they can give care early enough before it's too late, so that you don't have overcrowding of tertiary hospitals because of delayed referrals, complicated referrals, or irrational referrals. Women, children just landing up in tertiary hospital like Cama Hospital without any care, so they're dying, or they just being sent without any care being given at the primary level, leading to overcrowding and the increased mortality and morbidity that I saw in Cama Hospital. And all of this came from my experiences during residency. When you work in a hospital like Cama Hospital, you see very closely how extremely preventable problems, right? They're systemic, they're pervasive, but they're very preventable. Leads to loss of lives of mothers and children. They're so horrific, it's just the indignity of it all, right? Like, if just they had access to the right information at the right time, or if only the health worker knew how to pick up the risk factor in time, they could have been saved such horrific deaths,